Welcome to the Year Report of Findings video. In this video, we are going to review the function of the spine, the purpose of chiropractic, and look at normal and abnormal x-rays. We will also be discussing neuropathy, its causes, and the treatments available to help reduce the symptoms and adverse effects it can have on your overall health and well-being. The hope is to have you better prepared for your next visit when we will be going over your x-rays, and also to help you better understand the services your doctor is recommending to help you with your neuropathy symptoms. So let's get started with a review of the anatomy of the nervous system. We know the brain is the master controller of all functions in the body. The brain then sends electrical impulses down through the spinal cord. Branching off the spinal cord at each level are nerve roots, which then continue branching out to all parts of the body. The brain is protected by a hard outer casing called the skull, and the spinal cord is protected by the spinal column. When looking at the spinal column from the back view as we are here, the spine should be nice and straight. Any S-curves or lateral curves in the spine are called scoliosis. When looking at the spine from the side view, as we are in this picture, we can see that there are curves within the spine. And we'll talk more specifically about those curves here in just a moment. We know the spine is made up of small bones called vertebrae. Those vertebrae are stacked on top of each other and are separated by discs, which are the shock absorbers between the vertebrae. Nerves then branch out from the spinal cord and exit through small spaces between each of the vertebrae. Any pressure on any of these nerves can create symptoms associated with the path of that nerve. In this example, pressure applied to the C6, C7 spinal segment can create problems within the neck, but also can create radicular pain or symptoms into the shoulder, into the arm, into the elbow, the forearm, or even into the wrist and the hand. This picture illustrates where pressure on the lower back can create back pain, but also can create radicular symptoms into the buttocks, the gluteal region, into the leg, to the knee, to the calf, into the ankle, or the whole way into the foot. These symptoms can be as varied as muscle spasms, tenderness, numbness, tingling, burning, cramping, and of course pain. Misalignments of spinal vertebrae and the discs may cause irritation to the nerves, which could affect the structures, organs, and functions associated with those nerves. Looking at the chart here, you can see where misalignments within the vertebrae putting pressure on the nerves can affect the functions of the organs. So areas within the neck may affect the thyroid gland, the upper back to the heart or the lungs, the mid back to the stomach or the liver, the lower back, the kidneys or reproductive organs. So the misalignments don't necessarily always just create symptoms externally, but can affect our body internally as well. Chiropractors call these misalignments that put pressure on the nerves and decrease energy from the brain to the body and the body to the brain, subluxations. Removing pressure from the nerves innervating the regions of neuropathy is essential in helping eliminate your symptoms. Now we're going to take a look at some x-rays. We want to show you what normal x-rays look like and what abnormal x-rays look like, so when we present you with your x-rays, you have a better understanding of those. The first x-ray we're going to take a look at is a lateral or the side view of someone's neck. In this picture, you can see the person is facing to the right. You see their jaw on the right and the back of the skull on the left. And we're looking at the 7 vertebrae that comprise the neck, which are called the cervical vertebrae, and we number those C1 to C7. As we can see, the curve in the neck goes forward, and that's called a cervical lordosis. We can measure the angle of that curve by taking a line from the top vertebrae and the bottom vertebrae, measuring that angle, and it should come out to close to 43 degrees. That's an ideal curve in the spine. Also, the head should be located over top of the shoulders. We don't want the head moving forward, which is called a forward head carriage. We use a line from a mark in the skull and drop that line straight down. That line should intersect less than 10 millimeters in front of the C4 vertebrae. We can see in this picture it is 6.5 millimeters. That is a very good head carriage. The other thing we look at are the spaces between the vertebrae, which we see pictured here those spaces should be nice and equally spaced out between each of the vertebrae. That's where the discs are located. So we're getting an indication of the health of the disc by looking at the spacing. The other thing we look at are the front part or the bodies of the vertebrae. The vertebrae should be nice and squared off as we see pictured here. We don't want to see any lipping or spurring on those vertebrae, which would indicate osteoarthritis or degenerative joint disease within those vertebrae. The next x-ray we're looking at is also a picture of the cervical spine here at the top, but also the thoracic spine, which is where the rib cage is at. There are 12 thoracic vertebrae because there are 12 pair of ribs which attach to those vertebrae. When looking at the spine from this angle, the spine should be nice and straight. Again, any lateral or side curves in there are called scoliosis. This next picture is an example of an extreme case of scoliosis, and we can see curves of 36 and 51 degrees in this picture. The next x-ray we will be looking at is a near normal lateral or side view of the low back or the lumbar spine. There are 5 vertebrae in the lumbar spine, numbered L1 to L5. In this x-ray, if we look on the right side of the x-ray, this would be where the stomach or the belly would be over in this area. This area would be where the buttocks would be here. We can see the hips located here and the tailbone or the sacrum located here. Once again, we're looking at the spaces between each of the vertebrae where the discs are located, and those spaces should be nice and equally spaced out. The vertebrae themselves should be nice and squared off with no lipping or spurring or osteophytic formations at all. This next x-ray we're viewing from the back. So imagine standing behind someone looking at their low back and pelvic region. On the right side here, we can see the right femur head and hip joint, and the same thing over here on the left side. The top of the femur heads, as you can see, we have a line drawn across, and that should be nice and level. So the hips should be level, the pelvis should be level, and the spine should be nice and straight as we're seeing here. This next x-ray shows where there's imbalance within the pelvis. In fact, we can see where the left femur head is almost 13 millimeters lower than the right femur head. This is causing the pelvis to drop on the left and a scoliosis to the left occurring, which is about 17 degrees. The change in the heights of the femur heads can be caused by one leg being shorter than the other, knee problems, ankle problems, or even foot problems. So these issues need to be addressed to help balance the pelvis out and correct any of those scoliotic changes that we're seeing in this particular view. Now, if we have any curvature changes within the spine, whether it be a scoliosis or whether one of those forward lordosis has straightened out, it can begin to compress the spine and create degenerative changes. Think of this as getting brand new tires on your car and getting your wheels balanced, and then going out and hitting a pothole and knocking the wheel out of alignment. Those new tires that should have lasted you 30 or 40,000 miles may only last you 10 or 15,000 miles now because they're going to wear unevenly. The same thing occurs with the spine that's not in the proper positioning. Now, there are 4 phases of this, and I'd like to go through each of those phases with you on actual x-rays to show you what they look like. And we're again going to look at a lateral view of the cervical spine to show this to you. So the first x-ray we're looking at here shows a spine that has lost its normal curvature. So it's no longer has that forward 43-degree lordotic curve. In fact, this one is actually reversed at a -4 degrees. You can also see a forward head carriage. This one is a minus or a 31.9 millimeter forward head carriage. In this instance, though, we can tell that this is a relatively new injury or accident or trauma. It can be caused by whiplash or poor posture. The reason we know that it's newer is because there's no degenerative changes yet. All the disc spaces are still nice and even as we're looking at those here. Over time, though, just like that wheel being out of alignment on your car causing the tire to wear away, these discs can wear out. The next view is phase 2 of subluxation degeneration, which maybe 5 or 10 years later, we'll start to see signs of degeneration. Again, we notice a straightening of the curve in the neck and the forward head carriage, but in this area right here at the C5, C6 region, we are seeing decreased disc space between the vertebrae and lipping and spurring on the edge of the vertebrae. This is an indication of osteoarthritis or degenerative joint disease within the spine. If nothing is done to help this person, we will continue moving on. Another 5 or 10 years may pass by, and we'll eventually go to phase 3. Phase 3 now shows multiple regions of disc degeneration and arthritic change, which we can see throughout this whole region here. And again, if nothing is done here, it will continue to degenerate, and the final and most severe phase, phase 4, which now we have complete fusion of the spine. We don't see any disc spaces at all between these vertebrae here, and in fact we see large osteophytic formations or lipping and spurring on the edges of the vertebrae here. This is obviously extremely severe and is associated with a multitude of health problems, not just pain, as you can imagine, but also can affect the nerves that are going to organs and systems and create a multitude of other health problems. Now that we have a better understanding of what normal and abnormal x-rays look like, I want to go into a little bit more detail with you about what neuropathy is, some of the symptoms of neuropathy, and what we can do to help you with your neuropathy symptoms. We know that neuropathy is damage to or disease affecting the nerves. This may impair sensation, movement, glandular organ function, or other aspects of your health. Some types of neuropathies are due to damage of the axons, which are the long thread-like portions of the nerves which the impulses are conducted upon. Other types of neuropathies are due to damage of the myelin sheath itself, which is the fatty protein that coats and insulates the axon, much like the rubber that goes over the copper on a wire. Peripheral neuropathies may also be caused by a combination of both axonal damage and demyelinization. There are several causes of nerve damage and demyelinization. Some of those include vitamin deficiencies, including the B vitamins such as B1, B6, B12, also vitamin E and niacin. Other causes include exposure to poisons such as heavy metals like mercury or arsenic or lead or petrochemicals. Overuse of alcohol can also lead to vitamin deficiency, some of which we mentioned above, and create damage to the nerves and demyelinization as well. Autoimmune diseases such as Sjogren's, lupus, rheumatoid arthritis, or even Hashimoto's disease can also create problems with the nerves and lead to symptoms of neuropathy. Certain medications, especially those used to treat cancer and utilization of chemotherapy, can create damage to the nerves and symptoms of neuropathy as well. But by far the most common causes are subluxations, those of which we mentioned earlier, the misalignments of the vertebrae of the disc, which puts pressure on the nerves, and blood sugar imbalances. In fact, more than half the people with diabetes will develop some type of neuropathy. The symptoms of peripheral neuropathy vary, but some of those include numbness or insensitivity to pain or temperature, tingling or burning or prickling sensations, sharp pains or cramping. Some people even feel like you're walking on sponges because you can't feel the bottoms of the feet. Extreme sensitivity to touch, even light touch, and of course loss of balance and coordination. These symptoms are often worse at night. One thing we don't often think about when we're talking about neuropathies is the effects that it can have internally on the body. This is called autonomic neuropathy. It's also called visceral neuropathy and is a type of diffuse neuropathy which affects the nerves that serves the internal organs. Neuropathy affecting the organs via nerve damage can lead to a multitude of problems, including urinary incontinence, lack of sexual function, digestive issues, lower bowel problems, visual disturbances, and cardiovascular problems. Are there solutions to neuropathy problems? Well, sure there are. We know that true correction of neuropathy addresses the nutritional deficiency issues the person has, as well as directly treating the regions that are affected. It allows the body to start healing from the inside and the outside, decreasing the degenerative process of the nervous system. Of course, this takes time and commitment from both the patient and the doctors. By combining supplements, topical lotions and creams, a good eating program, and hands-on therapeutic treatments, We can accelerate healing and reverse the degeneration process that has already set in. Are you ready to end the pain, the numbness, the tingling in your hands or feet? Well, we have some in-office therapies to help enhance your results. One of the therapies we utilize is a Tesla Max muscle stimulator. We also use herbal leg wraps. We utilize cold laser therapy and vibration therapy. Of course, chiropractic manipulations to take the pressure off the nerves is essential, and spinal decompression to remove the pressure off any affected discs is very effective in helping heal the nerves as well. So let's review these procedures. Tesla Max electrical muscle stimulation is a technology which uses a proprietary form of alternating current, which is not available in any other electrical stimulation devices. So this is different than any other EMS units or TENS units, interferential, and all those types of units use a DC current. This one specifically uses an AC current. The reason is that using higher voltage and lower amperage allows the electricity to travel through the skin with less resistance. Therefore, more muscle stimulation without pain or discomfort is able to happen. Patients can tolerate deeper muscle contraction without any discomfort whatsoever. This improves lymphatic drainage, improves local circulation, and activates damaged nerves. The next therapy we utilize are the leg wraps. These were developed by a biochemist from UCLA specifically for neuropathy patients. They encourage circulatory and lymphatic flow in patients, causing painless cleansing of the tissues. It also releases toxins and acid buildups that are really common in neuropathy patients. These will concentrate the pain and numbness. The benefits are many, including increasing local circulation, reducing spasms, increasing range of motion, decreasing the retard disuse atrophy, decreasing the rehab time, increasing wound and injury healing, and of course, eventually preventing the potential of amputations. Laser light therapy is an FDA-approved treatment that utilizes therapeutic doses of concentrated light to penetrate and heal deep into the tissue. Cold laser therapy helps by actually stimulating microcirculation around the nerve fibers, which increases blood flow to the nerves and helps to heal and reduce neuropathic pain. This speeds up the healing process, heals damaged nerve tissues, repairs soft tissue and muscles, tendons and ligaments, and also alleviates the pain. Balance or proprioceptive exercises utilizing vibration therapy is used to enhance the input from our feet up to the brain. In addition to strengthening our muscles and improving muscular coordination, vibration therapy helps the sensory nerves grow stronger and repair. The increased stimulus of vibration triggers mechanisms of cellular repair and healing. Since the body is feeling more input through these nerves, it sends increased signals to enhance and repair those sensory nerves. The DRX 9000 true non-surgical spinal decompression system is the most advanced decompression system on the market and the one we use here at the office. This decompresses the intervertebral discs and achieves symptom relief associated with a multitude of degenerative disc problems. In this picture, we see lumbar decompression being applied to the patient. The next picture shows cervical decompression being applied. The theory behind spinal decompression is when we're lying relaxed on the table, our muscles are able to relax and we apply those spinal decompressive forces to spread apart the vertebrae of the spine. This relieves pressure on the nerves and the discs, but more importantly, the reduction in pressure can help draw in herniated disc fluids, reducing the size of the herniation and feeding the disc with the nutrients it needs to heal. Let's review the neuropathy treatments that are available for you. First of all, we want to remove all nerve interference. This includes the specific adjustments and, if necessary, spinal decompression. Then we want to incorporate specific neuropathy treatments. These will address the involved regions and include therapies such as the Teslamax, the leg wraps, laser, and neuromuscular re-education using vibration therapy. Lastly, we want to address the underlying nutritional imbalances. We utilize specific supplements to target the deficiencies. We also want to look at your diet and make sure we have dietary changes that will help with your overall health and well-being. Obviously, adhering to your recommended care plan is essential for a complete recovery. Again, I'd like to welcome you to Gonstead Physical Medicine. I hope and expect that you are going to respond well to your treatments, and just ask that when you do, you let others know of your experience. Unfortunately, there are a lot of people out there who do not know about or understand the benefits of chiropractic care and the specialized neuropathy treatments that we offer. Maybe even some of your own friends or family members. So please share your great experiences with them. They will be glad that you did. We'll see you soon at your report of findings.